So today we're going to talk about how sleep apnea affects your brain and specifically memory. In obstructive sleep apnea, what happens when a person goes to sleep? Gravity pulls on the tongue and it blocks the airway, and the air together with the oxygen stops being delivered to the rest of the body. Oxygen deprivation has very severe effects on the brain and memory. Repeated pauses in breathing impairs memory formation and overall cognitive health. It specifically affects our sleep pattern, especially when it comes to deep sleep and REM sleep. This is where long-term memory is actually formed. When we don't get enough REM sleep, it reduces the ability to remember facts, some procedures like skills and tasks, and overall memory. People who don't get enough oxygen in the brain because of sleep apnea or for any other reasons, they're at higher risk for developing Alzheimer's, dementia as they get older, especially in the long-term untreated sleep apnea. During sleep apnea episode, oxygen deprivation in the brain causes hypoxemia. And then when your brain wakes you up so you can take a breath, you have reoxygenation in your body. During this process, this cycle actually causes oxidative stress and inflammation, which is causing damages to the neuron, and particularly certain areas in the brain that are very sensitive to the oxygen deprivation. The area, it's called hippocampus and prefrontal cortex. There's some vascular and structural changes that are happening. Chronic sleep apnea is linked to reduced gray matter volume, and white matter is also compromised, and that slows the neural communication and impairs the attention and how fast we can process information.